Lung cancer is a devastating disease. It is the second leading cause of all deaths in the U.S., with heart disease as the first.
Anyone can get lung cancer, but most patients who are afflicted with this disease are either a current smoker or a former smoker.
Over 150,000 deaths each year are from lung cancer. In the past several decades, we have made great progress in battling common cancers like prostate, breast, colorectal, and lymphomas. Yet we have made very little progress against lung cancer.
At Walter Reed Bethesda, we are dedicated to fighting this disease. We have an amazing team of technicians, counselors, nurses, physician assistants, and physicians focused on a common goal: beating lung cancer.
Over 60% of patients diagnosed with lung cancer are diagnosed at advanced stage. The 5-year survival rates for lung cancer are only 15%, and this has not changed in 30 years. Veterans have higher smoking rates than the general population, and the incidence of lung cancer is twice that of our civilian counterparts.
If lung cancer research is done solely at civilian centers, any possible unique characteristics of the lung cancers or lung cancer patients found among the military may go unrecognized. As a military service member or military family member, you have potentially been in environments in both war and peacetime that may put you at risk for lung cancer. Some funds have been specifically directed to research in the military centers, as the government acknowledges the additional risk factors for lung cancer that our service members may incur throughout their careers.
Reducing your risk for developing lung cancer should start today. If you smoke, we would like to help you stop. We have new medications, new techniques, and an entire service that is here to assist you.
Quitting smoking or other tobacco products is a challenge. Developing a plan to quit is a good starting place. List your reasons for quitting. Set a quit date. Use nicotine substitutes if needed, such as nicotine patches, the gum, or the lozenges. It is important to follow up with your provider or counselor.
As a military medical cancer center, we currently have research and process improvement programs directed at all phases of care for the lung cancer patient. Current research includes smoking cessation, lung cancer screening, early detection using molecular biomarkers, minimally invasive diagnostic techniques, advanced molecular mutation testing of all lung cancers, advanced interventional bronchoscopic therapies, tissue banking of lung cancer tumors for current and future research, survivorship clinics for patients who have been treated for lung cancer and now are lung cancer survivors.
Now let's discuss some signs and symptoms that have been associated with lung cancer. Given that the lungs have few pain receptors, any signs of lung cancer are concealed until the disease has spread significantly. Symptoms that can indicate an early stage of lung cancer are coughing up blood or having blood in your sputum, shortness of breath, musical breath sounds or wheezing, pain in your chest, fatigue or recurrent infection of the lung. I strongly encourage my patients to see a doctor at the first signs of lung cancer.
Until recently, there have been no effective tools available to screen for lung cancer. However, with the completion of the National Lung Screening Trial from the National Cancer Institute, one has emerged. This tool is essentially a low-dose CT scan of the chest.
The current screening recommendations are for patients at high risk. These guidelines are published by the National Comprehensive Cancer Network and are supported by the American College of Chest Physicians and the U.S. Preventative Service Task Force.
A CT exam, or CAT scan, as it is often called, is the primary imaging modality we use in our lung cancer screening program. A CAT scan uses X-rays coupled with computer software to take cross-sectional images, often called slices of the body.
Although the screening program involves more than just a CT scan, a multidisciplinary team composed of smoking cessation counselors, pulmonary radiology and oncology specialist, or lung cancer care specialist, help to provide a comprehensive picture of the lung.
It is recommended that patients who meet the following criteria should be screened annually with a low-dose chest CT scan for lung cancer. The patient should be between the age of 55 and 80, have at least a 30-pack year history of smoking, and has quit less than 15 years ago or is a current smoker. The second criterion is a patient greater than age 50 with a 20-pack year history and a secondary risk factor. The secondary risk factors include a first-degree relative with lung cancer, documented occupational exposure to asbestos, hydrocarbon, radon, or Agent Orange, a personal history of head, ear, eyes, nose, throat, or lymphoma cancer, and/or a chronic lung disease, such as chronic obstructive pulmonary disease, COPD, and/or pulmonary fibrosis.
CT scans obtained for lung cancer screening may show abnormalities that will eventually not develop into cancer. This may cause significant anxiety for patients, so an honest discussion between the patient and a member of our lung cancer team prior to the CT scan is important.
Chest CTs are more detailed than standard chest x-rays and have been shown to result in a 20% decrease in deaths from lung cancer versus using screening chest radiographs alone. It takes about 10 to 15 minutes to set up and complete a chest CT. Once a screening chest CT is completed, radiologists from the Division of Thoracic Radiology interpret the images. All images and reports will be returned to your referring provider to discuss follow-up care and options.
One of the most critical components of the lung cancer screening team is a plan for addressing any concerning abnormalities on the CT scan. The multidisciplinary team will decide the next appropriate step in the evaluation of any abnormalities. This often involves a biopsy or a CT scan of the chest. If a cancer diagnosis is made or highly suspected, the lung cancer team and patient can decide the next best step together. If detected early, this often involves a surgical resection procedure for appropriate patients. Other therapeutic tools, including radiation therapy or chemotherapy, may also be necessary.
Over the past 10 years, treatments for lung cancer have expanded tremendously and include chemotherapy, oral pills, which can often shrink tumors with genetic mutations. There is a lot of hope with these new oral pills, and increasing efforts are being undertaken to find these specific genetic mutations.
The goal of the lung cancer screening program is to diagnose and treat any lung cancer as early as possible, but the best way to prevent lung cancer is to never smoke or to stop smoking.
Your support and participation are needed to make progress against such a deadly disease. Ask your medical providers about research protocols in lung cancer and join the fight against lung cancer.
If you have any questions or would like to be evaluated by the Walter Reed Bethesda Pulmonary Clinic staff, please give us a call at 301-295-4191. You can also contact us via the Walter Reed National Military Medical webpage or just stop by the Pulmonary Clinic's front desk.